Hi everyone and welcome to another episode of ParentTown TV. Today I'm with Dr. Gavin Ong from the Skin Specialist and we're going to be talking about eczema and your kids and how to treat the itch. So if you have any questions, go onto the ParentTown app right now and you can type out your questions and Dr. Ong will answer most of them in tonight's session. And after the session, we'll make sure to answer the rest of the unanswered questions. At ParentTown, we promise you no unanswered questions. Dr. Ong, thank you for joining us today.
Thank you for inviting me.
So we're going to be speaking about eczema.
That's right.
It's a very interesting topic.
Yes, it is.
Is it something that we see a lot in Singaporean children?
Yes. Eczema is actually one of the most common skin condition affecting quite a large part of the population. So we are looking at easily 20 to 30% of the entire population suffering from some degree of eczema.
Wow, I had no idea.
Yes.
And is it, do children have a higher propensity to get eczema or?
Just anecdotally, when I'm seeing my patients over the years, we tend to see more and more children getting eczema as compared to the older generations. Yes. Well, there are many postulates, but that's the general trend that I see, and I think some of my colleagues will agree with me on that.
Okay.
Yeah.
So you're a dermatologist or? Okay.
Yes, so I'm a dermatologist. So that's in simple English, that's a skin specialist. So as a skin specialist, we sort of took additional years, actually more than 3 years, to study just the skin alone, so that we have a greater understanding on this biggest organ in our body.
Oh, so why the skin? Because it's the biggest organ, or?
Not just that, but because it's a very visual specialty. Because other specialties, they are looking at lab figures, looking at chest X-rays, whereas skin is just there, it's visual. You can actually see what the problem is, and you can actually tell the patient.
Oh no, moms, I'm sitting next to a visual doctor. He's going to notice the small little acnes and wrinkles I have. Okay. So eczema, is it something that it's a childhood disease, or do you outgrow it?
Okay. So we do know that eczema has got a genetic component in some of the eczema sufferers. So because of that, quite a number of eczema individuals with eczema, they tend to show some form of that when they are young. And the good thing is that if eczema is very well controlled, the majority of them do go on to live very, very normal lives. They find that they don't really get eczema into their adulthood. Having said that, if someone has got eczema, severe form of eczema when they're young, and it's not very well controlled throughout their teen years, then that sort of increases their risk of having a bad form of eczema into their adulthood.
Okay.
Yeah.
But what exactly is eczema?
Okay. So eczema, to put it in a very simple way, eczema is a form of skin condition where the skin is chronically or very dry and very sensitive. And why this happens is because our skin is actually a very formidable organ. It serves its function by retaining things within ourselves, so that we are not spilling things out of our body. But it also forms a barrier against all the external things that our body is exposed to. So what happens in eczema is that this skin barrier becomes a bit defective. And as a result, a lot of things comes in to irritate the skin and triggers some form of inflammation, and it is this inflammation that causes eczema to become active.
So it basically is just an inflammation of the skin.
It's an inflammation of the skin that's triggered by the skin being unable to, basically a defective skin barrier. I think that's the best word to describe.
Okay. How can I tell if it's eczema or if it's just a rash?
Right. Typically, someone with eczema would have a very dry skin to begin with. So, if you look at them carefully, you'll find that if you compare them with someone without eczema, and when you run your hands or fingers over their skin, you automatically know that their skin is much drier, much smoother. Sometimes to the extent that it's almost powdery. They get a very powdery texture on their skin. That's all manifestation of skin dryness, and that is not good because it means that if they're not well controlled, they can actually move on from just being the dry stage of eczema. So eczema comes in different stages. So in the best state, the skin can be just look fairly normal but dry to when it becomes truly active, when it's not just dry but red, angry, and inflamed and itchy.
So if I start noticing dry skin,
Yes.
is there something I can do to prevent it from becoming eczema?
Yes. So the simplest and most effective way, but sometimes a bit hard, in our weather, I'll explain why, it's to actually use moisturizer. Moisturizer is the best form of treatment for eczema and for eczema control. And by restoring moisture to the skin, it helps to repair the defective skin barrier that I was talking about earlier. So once that's repaired, you'll find that the skin becomes a lot more resilient. It's able to tolerate a lot more things that irritates it. And then it doesn't break out so easily into an itchy red rash, and etc.
Okay, fascinating. So we've got some questions here from our moms.
Yes.
We've got Mommy Avantika who says, what are the best home remedies for eczema that are safe to be used for babies?
Okay, so home remedies, as in things that you can pick up from the kitchen or anything.
Yeah.
So I guess if you're not, if what she meant is not having to see a doctor to get prescription medications or creams, then I think the easiest thing anyone can do to apply on the child, especially if the parents suspect the child may have some degree of eczema or some skin dryness, so use some good moisturizer. It's as simple as that.
Any recommended brand?
Am I allowed?
Sure.
Okay, so there are some common brands out in the market that are very popular. So if you walked into stores like Watson's, in Guardian, etc., certain brands like QV, Physiogel, Cetaphil, Eucerin, these are some of the very common brands that that makes very good eczema products. So they are very suitable for individuals with eczema skin. They don't contain fragrance, and fragrance is important because sometimes it's these things that cause or that irritates the skin. So these products usually do not contain fragrance. They are very gentle. They don't irritate the skin, and they moisturize. They are very rich moisturizer.
Okay, thank you for that. So we've got Elise Lau who's asked, my hubby got eczema.
Yes.
Does putting my LO on partially hydrolyzed milk effective in preventing eczema? My baby is currently 6 months. Partially hydrolyzed milk.
Partially hydrolyzed milk. That milk or any other substances, those are very liquid. So they probably do not have sufficient moisturizing property. So I would still advise parents to or their spouse to use a standard moisturizer that they can find in the market.
Great. We've got Mom Pavin who's asked, are there any practical things that you can do to prevent eczema?
Again, I'll probably be saying this again and again because that's really how important. Yes, moisturize. But of course, one thing to highlight is that it's always easy for a doctor or dermatologist to say, go ahead and just moisturize 3 times a day, 4 times a day. But in reality, given our weather, it may be easier said than we can actually go and do that moisturizing bit, because some of my patients, for example, they may be working outdoors throughout the day, and to ask them to put on another layer of moisturizer when they are already feeling very uncomfortable with their sweat and their oily skin, they may find that it's just too oily for me to put on another layer. Or sometimes the eczema may be in places which are difficult to apply, so it's not convenient for them to apply. Let's say if you need them to apply in the middle of the day, for example.
Understood. We've got Mummy Regina Lim who's asked, what's the repercussion of using steroid cream to treat eczema for baby?
All right, that's a very good question and a very important question and a very commonly asked question. So steroid creams is actually one of the key pillars for eczema treatment. We do need to use steroid creams, but the key thing is we need to use them appropriately. So when you have a rash and the doctor says, here's some steroid cream, and you need to apply them on the rash, please do so, because this will help to bring down the inflammation quickly. Conversely, if you do not have a rash and yet you're using the steroid creams just to get rid of, say, the itch, or just because it's a cream, you're not sure what it is, and you just apply on the skin, then you might run into problems, because steroid creams, when used long term and when you use it on non-inflamed skin, it can lead on to things like skin thinning. You start to see that the skin becomes very paper thin, starts lots of blood vessels showing on the skin.
We've got Jacqueline who's asked, I have eczema myself. Will my child be affected though she does not yet show signs of it?
Right.
So I guess it's the genetic question
Yes. Yeah. So there's a genetic component, but it doesn't mean that just because you have eczema, your children must have eczema. So your children just have a higher risk of getting eczema as compared to the general population. And it's not just eczema alone. So let's say the parent has either eczema or even things like asthma or sensitive nose, what we call allergic rhinitis. All these three conditions are sort of related, and if a parent has one or a few of these or all of these, then their children may have a high risk of developing either one of these three conditions.
Okay.
Yes.
And an anonymous mom wants to know, is there any chance that baby skincare products can actually lead to eczema?
I would say that's always a possibility, because as much as we like to think that all children's products are safe, gentle, we really need to know where they're made from, the manufacturing source. So if you
check the labels, Mom.
Yes. So if it's of dubious sources, then we really have to be very careful, because as I said, it's not sometimes about the moisturizer itself, but sometimes they want babies to smell nice. They put lots of fragrance inside the baby products, but then it's maybe this fragrance that irritates the skin. Yeah.
Okay. We've got Ash Tamayo who's asked, are there different types of eczema? So you mentioned there were.
Okay. If we are looking at the ones that starts from the young, then the most common form will really be atopic eczema. Okay, that's the one that has got a genetic basis, and that's the one where we've been talking about with chronic dry sensitive skin. There are other forms like, for example, seborrheic eczema, steatotic eczema, very technical terms, but those tend to affect the slightly older age group. So when we are looking at more like newborns, children, toddlers, or even teenagers, we are really looking mainly at atopic eczema.
And Kelly asks, what are the symptoms for eczema, and if there's slight signs for a 4-month-old, is there any remedy for face and stomach area? So moisturize? Yes,
but before that, what's the most common symptom? So itch will be the main thing that anyone with eczema will experience. So their skin will feel not just dry, but they'll feel itchy all the time. And what happens when a person feels itchy? The natural tendency is to scratch. And when they scratch, what they do is that they actually aggravate or accentuate or make worse the eczema. So in children, the areas affected tends to affect the places like the cheeks, the elbows, and when they become a bit older, you may find that it starts to move to other parts of the body like the neck and in front of the elbows or behind the knees.
So itching makes it worse?
Itching will make a person want to scratch more, and it's the scratching that makes the eczema worse.
Okay, so for a 4-month-old baby, would you recommend the moms wear mittens? And
yes, because clearly when a child's very young, there's no way you can stop a child from scratching himself or herself. So the key thing is to settle the inflammation. Once you settle the eczema, settle the inflammation, the itch will stop and the baby will stop scratching himself or herself.
Okay. We've got Mom Emily who asks, do you believe that alternative medicine or traditional Chinese medicine can help ease the effect of eczema?
I believe there's always a role for complementary medications, complementary medicines in helping individuals with eczema. But the key thing is knowing what is most suitable, what is most appropriate, and what is safe for them to use.
Okay. Deepa asks, my daughter has slight eczema. How do I find out what triggers it and prevent it from getting worse?
Earlier on, I talked about eczema having a genetic basis. So that is the sort of the root cause, so to speak. But many things that we are exposed to in the environment actually can either upset the eczema and make it worse or calms it down. So those will be the triggers as what this viewer has put up. So common triggers that can aggravate eczema will be things like a changing climate, the climate becoming warmer, hotter, the humidity becomes too low, or if a child falls sick, all these things can trigger an eczema flare. So the question was...
so she wants to know, how does she prevent it from getting worse?
Okay, so the key thing is still moisturize, because once you moisturize the skin, you calm it down, the skin, it's more settled, it's more resilient basically. So it doesn't allow the eczema to come up so easily.
Okay. Maya asks, will eczema stop occurring when my children grow up?
So that was, I've sort of answered briefly earlier on. So the key thing is about good control. So if someone who's got eczema since young, but if the parent or the child has been able to manage the eczema very, very well, there's a very good chance that the child will grow into or will become an adult with very, very little active eczema. That's the key thing, control.
Okay. B. Fernandez, what's the difference between eczema on a child's body and that of an adult?
Okay, in terms of the appearance, there's actually not much of a difference. What's the main difference would be where the eczema commonly shows up. Mm-hmm. So in the child or in the baby, the common areas, as I mentioned earlier, will be like places on the cheeks, elbows, and the knees. That's because in children, they tend to grow a lot, so that irritates the cheek. Mm-hmm. And then they tend to crawl, so that affects the elbows and the knees. Whereas in the adulthood, they get a very typical what I call adult distribution, where they get it around the neck, in front of the elbows, behind the knees. These will be the areas that comes up with the eczema first. Okay.
We've got Daddy Darius Chong asking, are the adult moisturizers okay for babies?
Yes. Yeah. Certainly. A good moisturizer, that's the good thing about a good moisturizer. A good moisturizer can be used on any part of the body for any age group. So that's how a good moisturizer should be.
We've got Mom Kelly asking, my boy starts to have eczema after 5-in-1 and it can't seem to cure or lessen the red rashes. Why is this so? How can I cure it? So 5-in-1 vaccination.
Okay, I don't think the eczema is due to the vaccine. It's probably just a coincidence that the child is vaccinated at the time the eczema starts to become a bit active. So how to prevent it? Again, very mild, dry skin, moisturize. Of course, certainly when they start to become really red, active eczema, when it's itchy, the child scratching a lot, then they should see a doctor, because on top of moisturizer, some anti-inflammatory creams like steroidal creams or even non-steroidal creams may be necessary to bring down the inflammation.
Okay. We've got a pregnant user here who's 7 months pregnant. She's tired of scratching. She has red rashes on her body, circular, red and dry, looks like ringworms. Which cream and medicine is not harmful during pregnancy?
Okay, so this is not quite. This will be slightly. Will be deviating slightly out of eczema, because
eczema for children.
Yes, and because based on what she described, it may not necessarily be an eczema that she's experiencing during her pregnancy. It might be a different itchy skin condition that commonly happens in pregnancy. I think because of a few possible diagnoses, it might be better for to get to see a dermatologist and then get the dermatologist to have a proper look, and then the dermatologist can then properly advise her
and diagnose it.
Yeah, what are the suitable creams to use, or even what are the safe oral medications to take if that's needed.
Okay. We've got Mom Tan Kin Lian who's asked, recommendation for laundry soap or detergents for babies with eczema.
I don't think you need a special detergent for that. The more important thing is that all the clothes should be thoroughly rinsed, such that you remove all traces of detergent. I think and I assume most modern washing machines should be able to do that. Yes.
Okay. We've got a mom asking for emu oil for eczema. Emu?
Okay, so EMU.
Yeah.
Okay.
EMU.
So again, these are some of the things that goes in and out of fashion. Many things goes in and out of fashion on how we can use certain things to help individuals with eczema. There are no good medical evidence or scientific studies at the moment to support the use of emu oil. So the standard advice on moisturizer for dry skin, anti-inflammatory creams for inflamed skin still stands. If the parent want to try immo oil, I would say proceed with caution. If it helps with the baby, helps with the child, and eczema gets better, go ahead. But if it sort of unsettles the skin, then it may be prudent to discontinue.
Okay, we've got one last question,
Yes.
and this is asking about aloe vera gel
Yes.
and cornstarch powder. Do you have any opinion on those two as treatments?
Okay. So aloe vera, no, back in the days when I first learned about aloe vera, it was as an aloe vera gel that people apply on their skin after a suntan or sunburn, and it's still commonly used as a common moisturizing ingredient in many products. It is a moisturizer, but I think in the context of eczema, it is usually not moisturizing enough.
Okay.
So I think so when a moisturizer is not moisturizing enough, you have to sort of how should I say, you have to compensate by moisturizing more frequently.
And what
So-
about cornstarch?
Cornstarch, if I'm assuming it's the powder form, then it's no different from, say, someone using talcum powder on their skin. We generally discourage that because what powder does is that it absorbs whatever minimal amount of moisture or oil on the skin, and the outcome is that it makes the skin drier.
Thank you, Dr. Ong, for joining us today. Any last advice for our parents?
Right. So still the most important word, moisturize, because moisturizing is the main thing that can help control an eczema. And as with everything else, if you've done that, the eczema is still out of control, go see a doctor.
Okay. Thank you very much, parents, for tuning in as well. So today's session was on eczema. I'm sure you learned quite a lot. Tune in on Tuesdays and Thursdays every week onto the ParentTown app and you'll learn about a new topic. Thank you again. Good night.
Good night.